Good day. All right, you're welcome to today's lectures, GMP 123. I think we are done with the direction, right? We are done with direction, right? So I believe that you can solve any question on that. Good. So, have we done drug nomenclature here? We've not done drug nomenclature. Okay. Let me see that course material. Yes, I'm talking to you. Please, can I get just one please bring it here. What are they dragging? No, come like this. Thank you. So we've done introduction, define pharmacology, right? Right? Have we discussed drug and medicines? Huh? So I say yes, you're saying no. We discussed drug and medicine, right? So you can differentiate between drug and medicine, right? Good. Good. So have we done classification of drugs? Drug classification. Okay, let's start from there. Let's start from there. So let's look at drug classification of drugs. Okay, drugs can be classified, of course, with the definition of drug. I don't need to go back there because I have already explained what drug is. So there are different criteria. Are we together? There are different criteria drug you can that used in classifying what drug. There are different criteria, but the one I will focus on the one that is in your what curriculum. And basically drugs are classified according to their actions or functions. Are we together? To their actions, functions, or you can call it therapeutic words use. Okay, now drugs can also be classified based on their forms. Are we together? Then they can also be classified based on the actions, based on their forms, and based on when they get to the body. eh, Apart this is what they do, and the forms, and how they do what they do. Am I communicating? I'll discuss this and then come to that. This one here we have pharmacodynamic agents. Then we have, under this one, we have pharmacodynamics agent. Then we also have, chemotherapeutic agents. But I know where I said is there. I will explain. Let me finish this and this first. Now, here, according to the actions and what they functions, here you have, yes, where you start seeing, you start hearing, yes, things like anti-malaria, antipyretics, analgesics. From their name, you can easily say what they do. Am I communicating? When you mention anti-malaria, you know that anti mean against, right? Malaria. They do what? They fight against what? Plasmodium that causes what? Malaria. Am I communicating? So, coming. Why I put asterisk here? Do you know why I put asterisk here? Because there are some of these functions here that are under pharmacodynamics. There are some for me that are also under what? Chemotherapeutic. That's why I put the asterisk there here. Am I communicating? In fact, there are some material you will see, they will just tell you that drugs are classified into two: chemotherapeutic agent and the pharmacodynamic agent. So it depends on the criteria you are using. Am I communicating? That's why I said it depends on the what? Criteria. That's why sometimes you see the one that will belong to this one and also belong to another one based on the criteria, the criteria you want to use. So now, here you have, I have mentioned anti-malaria. I have mentioned we have antibacterials. Here you have your antibiotics that are all here. Antiviral drugs. They fight what? Virus. Am I communicating? Then we have your anti-diabetics or hypoglycemic agents. They control blood what? Blood what? Sugar, right? Anti-helminths. Anti-helminths, they fight against what? Worms in the body, right? These things are in your course materials. Am I communicating? And I believe you have gone through them by now, right? Have you? If you have not, you are wrong. If you are not by this time, you are what? Wrong. Then we have there are many of them. Antihypertensives for what? There are many of, and you have examples of them. Okay. Then we have antifungal for what? The treatment of fungal what? Infections like candidiasis, right? Then you start seeing things like fluconazole. You start seeing things like griseofulvin, the one you call fusin. You start seeing things. There are many of them. Then under itraconazole, there are many of them. Then we also have your okay, I've mentioned anti-analgesics, right? And antipyretics. You also have hematinics. Hematinics is for what? For blood, right? Good. You see how you say you have iron containing what? Blood tonic, right? Then another hemoglobin and another ones. Are we together? Then you also have give me examples of those you know. Oh yeah, let me hear from you. There are many of them. Let me hear from you. Oh yeah. Anti-inflammatory agents. Good, I like that. Anticonvulsants. Good. Anticonvulsant, not anticonvulsion. Anticonvulsants. Antiemetic for what? Worm? No, it's not worm. Antiemetics are for what? They are anti against emesis. What is emesis? Emetic is from emesis. What is emesis? Emesis is what? Vomiting, right? So they are used to take care of what? Nausea and what? Vomiting. Hope you know the difference between nausea and vomiting. What is nausea? Good, good. So, any other one? Any other classification based on the forms? Sorry, actions and antidepressant. Good, good. Anti-anxiety. Mycobacteria. Okay, yes. For tuberculosis. Good. Example. 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 Isoniazid. Is there anything like isoniazid there? Is it there? Cotimazole for tuberculosis? No. Cotimazole to treat tuberculosis. Where? Where? No, it doesn't treat. Cotimazole doesn't treat it. Am I forgetting? It doesn't. Okay, you've been opportune to work in such. It doesn't. It's not. That it does. There are other things that may go with a prescription, but that doesn't mean that this treat this. No, you can't have tuberculosis and you go and start taking cotimazole for you to treat tuberculosis. No, it may be in the regimen for other maybe opportunistic infections, not that is used to someone that is confirmed to have tuberculosis. You can't know. It's not all things like isoniazid. Even though arsenal they have preventive system, but at least is an bacteria. We have the many of them. Ethambutol, right? Yes, ethambutol is there. Okay, antipsychotics. Abundala. Anti-dementia. What is the dementia? Please, any class. Hello, please, any class you are calling. Please make sure you know at least one example of each of them. Try to know at least one. Okay. At least you can learn more, but at least try to. In fact, try to learn at least three examples of each of them. Is it much? It's not. It's not. No. Any other example? Okay, so what I mentioned, anticonvulsant. Anti-diarrhea, good. Anti-diarrhea is there. Gastrointestinal agent. Okay, there are many of them. Anti-ulcers also there, right? Please, can you hold that door, please? Open it well. Get something. Maybe take one wire or something. Just hormonal agent, okay? Scatter muscle relaxant. I agree with you. There are a lot of them on there, so name the specific. Antihypertensive is also cardiovascular agent. It's three of us. So go inside it and then break it down. Okay, that there. For skin. Okay. Example. Please, you know examples of this though. Even if it's not in the material, come in. Even if it's not in the material, please, try to read them up and at least be able to give me one or two in case. Yes. Crew what? Okay. These things are simple. Just Google them, okay? Google them. If you have MDEX, go through MDEX and build yourself. I'm happy the way you are going. It shows that you are doing something. That they are doing what? You are doing something good with your time. I'm happy. So based on their forms, based on the form, actually, this thing, when these forms now talks about, is it talking about drug or medicine? Let's check well. Is this really talking about drugs or medicine? It's medicine talking about, right? Based on the form, but you know that sometimes the two words are sometimes used interchangeably, but they're not the same thing. So these forms point towards what medicine, different forms. Okay, so drug can be classified in different forms where in which they are formulated. Okay, we have things like those that are solid, those that are liquid, those that are semi-solid, then those that are gaseous, so right. So under solids, we have things like, name them, tablets, capsules, tablet, capsule, you said tablet now, powder, God bless you, granules, what else? It's tablet now. Chewable, chewable is tablets, no, emotion is under liquid. Someone has mentioned, powder. What of semi-solid? Cream, yeah, ointment, no, no, aerosol is not under semi-solid. Inspection is semi-solid. Suspension is liquid. Suppository, but you can call it solid. So it can also be under what, but it's more of a solid than what semi-solid. Okay, under one. Say your own. What of liquids? You have things like syrup, suspension. What else? If you see suspension and syrup, would you know? Can you differentiate them? If you see them, if you see suspension and syrup, can you differentiate between them?
Suspension and the drug used in producing it is always solid form. That's why I always have shake for the police. Because it's suspension under the bottle.
Okay, we have, in liquid form, we have the ones that where the solid completely dissolves. If something dissolves in a liquid, you will not see that thing again. It's only the color that you notice, if it has color. But I can see through it and see you. If I dissolve something now in water, but the color may still be there, but I can see through it depending on how dense it is. Am I communicating? You will not see particles inside it. That is a solution altogether. Now, but if it is suspension, it doesn't dissolve, it disperses. Suspension is a dispersion. It disperses, it doesn't dissolve. So if that solid particles will not dissolve, you can see the particles. So, but all you need to do is that when you are formulating suspension, there's something they put inside. Apart from there's one of the ACPN. Remember ACPNs now? There's an ACPN they add. We call it suspending agents. What this ACPN does is that if you don't put a good suspending agent, what happens is that if you leave the suspension in one place, they will settle down and they will remain there and come together, form a strong mass at the bottom. If you see any suspension like that, it doesn't have a good suspending agent. Something is wrong with suspending agent, because suspending agent won't allow you to form that kick under the bottom of the bottle. If there's a good suspending agent, even though it has settled, once you bring it up and shake it, they will disperse again. So most of the liquid one, they will ask you shake well before they are what? Suspension. Do what? If you don't shake well, the drug will not disperse uniformly. So if you don't shake well, you may get 5 ml or 10 ml to drink, but there's no drug inside it. There will be no drug inside it. If 5 ml should give you, if 5 ml should contain like 50 milligram of the drug, for example, now, if you don't shake well, you may take 5 ml for that top, it may contain 1 milligram or 2 milligram of the drug. But if you shake well, it will uniformly disperse in the entire word bottle. So that if you now take, you know that if you take 5 ml, you know you are actually taking what? 50 milligram. Does it make sense? So anyone like that is called is suspension is like that. Are we together? So that difference between suspension and even emotion is a liquid form. Emotion is a liquid form. Emotion is like oil and water mixed together. Like your cream. No, no. Perfume is purely is not emotion. Things like your cream. Your cream is a type of emotion because there's any cream you see, there is water and oil mixed together. Using emulsify, you know, water and oil can never mix. But if you use emulsifying agents or what you call, if you use excipients, we call emulsifying agents or emulsions. Don't worry, this one is purely pharmaceutical. This I'm saying now is purely pharmaceutical. You have no business with that. But at least I just want to say what it is because of the forms here. So that if you see them, you can distinguish between them. Yeah. Does it make sense? Okay. Okay. Who is the person? Oh yeah, come on, go and meet her outside. Am I communicating? To take the okay. So your cream is an example of emotion. There are two types of emotion. There's one that are basically I mean cream. There's some cream that are you see. There's a cream that are oily, true of us, and there are cream that are not oily. So the one that is oily, there is more of oil than water. So in that one now, what oil is dispersed, water is dispersed inside oil. That's why oil is more. That's why the cream will be oily. But there's some cream that are not oily. In that one, water is dispersed inside water. Oil is dispersed inside water. So water is more. We call that one oil and water emulsion, and water in what? Oil emulsion. The cream in which the water is more, you see, is somehow watery. You wouldn't even know that that's oil inside. But so far it's a cream that's oil, but water is more. That one is what? Oil and water. Then the one that oil is more, you feel the oil is water in what? Oil. Now let me not go far into that. But the point I'm making is that emotion is different from suspension. At least I've mentioned as examples of emotion, right? So you have your ointment. These are semi what? Solid. Semi what? Solid. Then we have your gases. Things like gases are divided into two. We have pure gases, the one that are gases. So some of these drugs used as an anesthetics. Anesthetics are also a class of drugs. The one that if the patient want to undergo surgery, they will now inject the person, right? Either that's what they call local anesthetic. Maybe if this is where they want to surgery, they can focus on this area. That's why now the patient may be looking at what you are doing. You'll be seeing it, but you will not feel any pain. That one is local anesthetic. But the one where the patient will sleep off, that one is that one is general systemic. That one now make the person CNS. That one target the CNS. The person will not sleep off. When he now wakes up, you be like, ah, what happened to me? So now these are the anesthetics. So we have gases that are under what that are used for what anesthetics. Now under gaseous forms, we have the aerosols. They are one that in form of aerosols. Aerosols can be where we have it's pressurized. We have maybe solid or liquid is dispersed inside a gas and gas that is pressurized, so that if you press it, that thing you normally use your perfume, your shirt. These things are aerosols. There are some. you think that it's gas that is coming out, but it's actually, so then when they touch the surface, the liquid will appear on the surface.
Yes.
But when you press it, you think it's gas. There are some solid will appear. True of us. Am I communicating? Some of your air freshener, if you press it, then even so, even there are some even you are inhalers. Am I communicating? And that's why you don't inhalers is here, right? Is it here or here? Yeah. So these things are different forms. Am I communicating? Different from the drug and what come. Now let's go to what this pharmacodynamic and chemotherapeutic what agents. By the time I discuss it, you understand that some here are either in chemotherapeutic or either in what pharmacodynamic. Now, so in pharmacodynamic agents, those ones, those drugs, see what they do. Are we together? They don't fight any particular agent. They don't fight anything in the body. They only work on receptors in the body to change physiological of the body, but they don't attack anything. There are nothing like maybe is fighting this organism. Let's assume you have infection now. If you take a pharmacodynamic agent, it has no business with plasmodium. It has no business with virus. Am I communicating? It only go to manipulate receptors in the body so as to change and they exert their what action. So you can, this classification may be called classification based on how the drug exert their what action. Am I communicating? So now there are some that based on that now, one is action, from functions, therapeutic use, forms, then how they exert their what action. Some exert their action pharmacodynamically, some exert their action chemotherapeutically. Are we together?
Yes.
Now, those that exert their action pharmacodynamically, same things like we call them those that exert their action pharmacodynamically, we call them dynamic agent. Things like drug for antibiotic is not pharmacodynamic, it's chemotherapeutic. I will explain. Now, things like ibuprofen for pain for headache or paracetamol for headache, there's no particular, it doesn't fight any agent in the body. It goes to pain center, go to receptors, work on it to change some certain things to bring it down. You know the body, do you do physiology here? Have you done homeostasis? No, the body has a way. When this one goes up, it will bring it down. Things like that. So this one, they have no business. Things like drug for anti-diabetics, insulin. It has no business with any. It's a for dynamic agent. It goes to work so as to bring down the what sugar level. True of us. Am I communicating? There are many of them. Now, drugs for chemotherapeutic agents are the one. Their job is to target a particular agent in the body that is causing the problem, to kill it, to deal with it. Chemotherapy. Things like anti-cancer agents. Anti-cancer agents, they target cancer cells and kill. You know, cancerous cells are bad, so they target cancer cells and kill the cancer cells. That's what they do. So they are under chemotherapeutic agent, anti-cancers. Now, things like anti-malaria. Anti-malaria is the chemotherapeutic. They are chemotherapeutic because they target plasmodium that causes malaria to do what? Antibacteria. They target bacteria. Anti-fungal. They target the what? The pathogenic fungi. Anti-filarial. They target what? Filarial worms. True of us. Anti-amin, they target what? Worms in the body. Roundworm, Ascaris lumbricoides, and other worms. I think you must, because this is a community practice, community this. You must have done all these parasites, right? You target them and to do what? To deal with them. So any of these agents that target a particular causative agent to tackle it, to kill it, is under what? Chemotherapeutic. Yeah. Does it make sense?
Yes.
Does it make sense? Good. So then you start having things like under medicine, just as we have forms, you have some medicines. There's a medicine we call POM, prescription only what? Medicine, OTCs, over the counter what? Those ones are the one drugs that you cannot just go to pharmacy to buy. You need doctor's what? Prescription. So any drug sachet, any drug sachet. Let me look at this one. This one I've been here for junk of. Who abandoned it here? Any drug you see, you have written on the packet POM. Once you see POM, even though we don't even keep the rules here, sir, but it's well. POM actually means what? In case you see yourself in a sane environment tomorrow, just know that POM means prescription only. So you don't just go and tell them please, I want to buy this drug. No, it must come from doctor's prescription. In a sane environment, they don't give you. Sane, you don't know what is sane. They will not say it to you. It must come with doctor's prescription. Things like vitamin C, all these ones, you can easily go to. Those are over the counter. Anti-cancers, you can't just go and say I want to buy anti-cancer. No, nobody will talk to you. Some antipsychotics you mentioned here, you cannot just go to buy it like that. Even some antibiotics, you cannot just go to start buying. Just look at the packets. Those people that if the company actually know what they're doing, if it's POM, they will write it on the packet. POM. They will write on the packet. There's no POM on this one. I don't know. POM means prescription only medicine. That's the meaning. OTC, over the counter. Okay, you've not read it here. I couldn't have found there. Number one, the first page here. So people are asking me again what they mean. Second page. Hey, OTC means what? Over the counter what? Medicines. Over the counter. Over the counter. Then POMs, prescription only medicine. Your diazepam is POM. Your morphine is POM. Then your normal the vitamin C, paracetamol, antacids you just go to buy. They are what? Under what? OTC. Over the counter. Okay, the next thing I want us to look at. We'll look at drug nomenclature. Have we discussed it here? No. We have not. Okay. Drug nomenclature. From the name nomenclature, nomen. Etymologically, the term nomenclature is from two words. What? Nomen meaning what? The other one is what? Platura meaning what? It's talking about system of naming, okay? So generally nomenclature means a system of naming. System of naming something is what? Nomenclature. Now, just as we have in your biology, we have your binomial system. Biology is a binomial system of what? Nomenclature, where every organism, be it plant or animal, has two names, right? The name of the genus and name of the what? Species, right? For those that did biology. For those that did biology. I'm not talking about those that wrote, but not those that did it. So we have your what? Your genus name and what? Species name. So in biology we have binomial system of what? Where you have two names. But in drug Drug nomenclature means system of naming of what? Drugs. Drug is more of trinomial, three names. Every drug will normally have three names. The first name is the chemical name. Second name is what? Generic name. And third name is what? The brand name. Are we together? So you can call the generic name, the chemical name is chemical name. You can call the brand name, the generic name, non-proprietary name. Then the brand name can be called proprietary name or trade name. Proprietary name or what? Trade name. Are we together? Are we really together? We are sitting as if we are not together. Anytime you see that, your man will just disappear. Your man may go home or travel to Lagos or travel to Ghana where you may not even have international passport already, but you will travel to Ghana and stay there. I mean, you may be with your sister in UK having lunch when you are not even secure their international passports. So please sit up so that your man will be here with us. Are we together? All right. So we have the chemical. Let's start with the chemical name. But before you understand this chemical name, there's something I want to say. Have I mentioned there's some part of source of drugs I want to talk about before we go into this? Have I ever mentioned here in this class about natural drug, synthetic drug, and semi-synthetic? Have I mentioned it in this class? No, actually, basically, that's why it's very important. Listener, if you say that you did your O level, it's very important you actually did it yourself. But there are some things that you keep recalling again. There are some foundation that you build upon. And if you don't have that O level foundation, it will be affecting you till today, even till tomorrow. In fact, your level of confidence will go down. Because each time they call you upon important tasks, you will mere you zo, but you don't know where they will come from because you are not confident. There's something is shaking in your foundation. That's a fact. So now, for those that did chemistry, yeah, those people that actually did it. Now, if you know about chemical formula, if you know about chemicals, you understand. You believe you will actually agree with me that everything is chemistry. Everything is what? Chemistry. Chemistry is life. Everything is chemistry. There is nothing in this life, there is nothing in existence has no business with what? Chemistry. It's not possible. Everything. There's nothing in it that is in existence. What is matter? So, if you define matter as anything that has mass and occupies space, if you define it as matter, then what is chemistry? You go far. No, come on. You know the data is on a lot of things will be coming up. Okay, but it's still going. The time just is when the time stops. That's when you know that there's an issue on the listing. The time is still going, right? The time in that red. And so now let's continue, please. Now, chemistry studies matter, changes, properties of matter. Now, there is nothing, even this thing I'm holding, if you break it down, it will go down to atom. So what are the we have we have components of matter. We have types of what? Matter. Am I communicating? We have components of matter. What are the components of matter? That one is states of matter. What are the components of matter? I'm driving at somewhere. Component of matter. Atom what? And what? And what? No. Atom, molecule, and ions. These are components of matter. Then, types of matter. You start seeing things like what? Elements, elements, compound, and what? Mixture. Am I communicating? Solid, gas, liquid, and plasma. Those ones are states of matter. Liquid, gas, solid, and plasma. They are states of matter. Now, if atom is one of the components of, even under atom, you start seeing subparticles, subatomic particles like what? What are the subatomic particles? Sub under atom. What are they? Neutron, electron. This is what chemistry studies. Now, if you know all these things now, you now realize that drug itself is a matter. So since drug is also a matter, drug has a chemical formula. It's a molecule that has formula. There is nothing you cannot break down to get to atom, even elements. Nothing. If you analyze this thing now, everything, if you analyze it now, you start seeing this thing, most of the components of this are organic because of the plastic and the foam there. Then you can start seeing semi metalloids or semi because of the semiconductors inside it. Am I communicating? Transistors and other things, even in the phone. All those things still come down to what? Elements. So they have formula, compound. Am I communicating? They may be together as mixture. But even the mixture contains different compounds and elements mixed together. Hope you know. Elements can be mixed together to form a mixture. A mixture has no formula. Now, a drug is a compound. If you naturally, drug can be extracted from plants and animals, naturally, or even microbiologically. But those ones, that drug itself, extracted from these sources, have their formula, chemical formula. So, if a company discover new drug, be it that they sourced it from natural sources. Let's assume that a plant has been used in olden days to take care of particular disease. Now, because we are in the world, we have things are becoming sophisticated now. You can actually extract those things, test the activity of that drug, extract from the plants, different parts of the plants. Maybe you have shouting here, you telling me, says, sir, asking questions, sir, this from these leaves, from the back of the plant, from the roots, these things are drugs that are extracted. Now, if these drugs are extracted, those drugs, initially they may not know the formula, but they may do what is called structural elucidation to see this, to be able to determine the structure of that molecule. So at the end, everything still boils down that this molecule, this drug, they have their what? Structural formula. They have their molecular formula. Am I committing? Now, because of they have the formula, from that formula now, they now give it a name, which is called what? Chemical name. So chemical name shows the what? Structural what? Formula of the what? The drug. Am I communicating? All these things I believe that I have succeeded in reminding you of what you read how many years ago. For those that actually read it too. So many years ago, I wanted it. So it's the kind of as you can see now, you are building on that. You can never escape it. Are you together? So now, with that now, because of the nature of this formula, some formula may start from here and get to here. Some chemical names, may start from here and get to here. Then what type of prescription sheet or paper that you can write such from here to here. The patient, in fact, the patient may get tired of it because for how long will it, so they still looking for another way to give it a name that will be generally acceptable. Those that didn't go to school to study chemistry will not be able to call that name. Am I completing? Even among some health professionals that did not study chemistry as a course, you may do your chemistry just O level, three of us. Even you put here, if you say you do the chemistry, and I can see now. No, if this thing are written in chemical name, you may not. You may need someone that actually did chemistry to be able to do what? Call those names. Am I communicating? You will see that the chemistry you did in your secondary school will not allow you to be able to call such to do those names, even know what they mean. So because of that now, they look for a name that is what? That will be common. Once a drug is discovered and you submit the new discovery to World Health Organization, they will give it a name. Of course, most of such name, they coin it from taking some letters from this chemical name to form the what? Generic what? Name. I'm talking about the generic name now. So the generic name is a common name that is the general name of a particular what? Drug, and is being given by is being approved. Even if you after the whole thing, it must be approved by the World Health Organization before the drug can be given such name. And immediately, do you know what is pharmacopoeia? Do you know what is pharmacopoeia? Wow. Okay, have you ever seen a drug where they will write, you see something like paracetamol, BP.
Yes. Yes.
Some you see USP.
Yes.
Some you see something like this. Now, these things are what are called the official books. Pharmacopoeia, they are reference books, official book that show standards of formulation of a particular what drug, and everything concerning what that drug being formulated as what medicine. So the standard, which this one is British Pharmacopoeia. This is British standard they use in this formulation. This one is International Pharmacopoeia. This one has its own standard. This one is United States Pharmacopoeia. We don't have IP. IP is Indian Pharmacopoeia. This one use standard of USP and US what standard. So that if you any drug you see, let me even see whether this one has any. Look at this one. This one is the brand name is Xenox, right? It's Xenox is the brand name. The generic name is ciprofloxacin USP. This one is USP. They use the standard of United States what pharmacopoeia. Let's assume that NAFDAC now want to. Hope you know that now if the drug is already in the market, NAFDAC can go to any place, any pharmacy, pick any brand they like and analyze it to be sure that this drug contains what they say, because they are telling us that this one contains ciprofloxacin 500 milligram. That's what they're telling us. NAFDAC can go to any pharmacy, any place they want to go to, pick any sample they want to pick, and go to their lab to analyze it to be sure that this thing that the company is claiming is inside it. There are some they analyze instead of seeing 500 milligram, some they see below, then they will not have issues with the company. Am I complicated? Yes. Now, so if now that, for example, now I want to analyze this drug now, this particular brand now, because their own is suppose are saying USP. Now that we use USP standard to analyze it, they will not go and start using British Pharmacopoeia to analyze a medicine that is in what formulated with USP. It's not possible. And I don't know if I'm communicating. So that's why any drug, any medicine you see without seeing such pharmacopoeia, something is wrong. Something is wrong somewhere. You rarely see without any. Just like surname, somebody's surname. Am I communicating? Just like your surname. If you are claiming that this is ciprofloxacin, generic name, there must be a standard used in the formulation, and that's the standard used to formulate this particular. I don't know if I'm making sense.
Yes.
So there must be a standard. Now, yeah, is what I've not seen. It's what unfortunate, but I've not seen. It's where we'll get there. International pharmacopoeia.
This US one, because I think that the drug was manufactured in US. Wow.
No, you can manufacture here. Probably not US, but that is the standard. But you can manufacture anywhere. Does it make sense?
Yes.
Good. So that's okay. Now let me give you an example of a chemical name to explain my point. Look at this drug. Look at this drug, the common drug you know. Look at 1-isopropyl amino. You can see it now, right? 1-isopropyl amino, 3,1-naphthoxy, propan 2-ol. This is a long name for propranolol. It's a long name for what? Propranolol. So propranolol is the generic name. Why this now I call is the what? Now tell me, if a patient if a doctor want to prescribe a patient have cardiovascular issues, maybe it may be arrhythmias, and you want to prescribe propranolol for the patient. Tell me, how will you write this type of them? So that's why simple what? Propranolol. Simple. Are we together?
Yes.
So now we have then the paracetamol you know is N-acetyl para what? Amino what? Phenol. N what? Acetyl para amino phenol. That one is the chemical name. But the generic name is what? Paracetamol. So paracetamol is what? The generic name. At least paracetamol is in the lips of everybody. Even someone that didn't go to school can call paracetamol. It's not true. So sometimes a drug may have more than one generic name. Sometimes a drug may have more than one what? Generic name. These things are here. So I wouldn't want us to wasting time, okay? They are here. Explain well what? Explain. I'm just pointing them out for you to let me give you that, because some of you, if I don't discuss them with you now, it look as if you don't have confidence to write it in exam, true of us. So that's why I will not go and start going deep. I'll just give you a clue and we move on. Does it make sense?
Yes.
Right. So now I said that some drugs may have more than one word, generic names. Note that, okay? Example of drugs that have more than one generic name. More than one generic name. How? Oh, yeah. How is it program? Yeah? God bless you. Go far. Lidocaine and what? Lidocaine and what? Xylocaine. Is this Xylocaine? No, it's not. Is it brand name of the generic name? Ligno. Lido and what? Ligno. Is there the material now? Ndị a do believer. Another one is there the material. Another one. Petty what? And what? Meperin. Petty din and what? Meperin. Petty din and what? Meperin. Another one. Paracetamol. Acetaminophen. Acetaminophen is USP. Paracetamol is what? You go far. Now, brand name. What are brand names? This one assigned by who? Is it those that produce the drug or those that produce the medicine? God bless you. It's those you go far. It's those that produce the medicine. It's those that produce the medicine. Give the brand name, okay? Yes. And even among the brand name, that's the one we call innovator brand. This one, you remember I told you how that drug, that to discover a drug, a molecule of a drug, to discover a drug, sometimes we call the molecule, is very, very costly. It runs in millions of dollars. It's not small money. Now, some company, if a company discover, it may be from natural source, new drug that had never been in existence now before. That company will look at the structure, tell the world how the structure is like. Then, at the same time, they will formulate their own first brand. We call it the innovator brand. And for up to 20 years, they undergo what is called, they will have a right we call patent rights. Patents. What it means that no other company will manufacture this drug, they will synthesize the drug, or even manufacture the medicine containing that drug for like 20 years. They are the only one that will be doing it and be distributing the whole world, so as to take back the money they do what spent in discovering the what drug. So most of these innovator brands over years would have entered the lips of what people, that even till today that's the one they know. Things like flagell, flagell. What is it? The cream of flagell, what does it contain? Metronidazole. Because that flagell, is the innovator brand. Those that discover this, they are the one that has that flagell. So it is in the lips of people. But after the year of patency, if his patent right expires, other company can now know the formula of that metronidazole and synthesize it chemically. And another company can start producing medicine that contains what? Metronidazole. In Nigeria today, we have Loxagel. Loxagel is a brand of metronidazole by M&B. We have Mgel. Mgel is a brand of metronidazole by what? Emzor. So different Dugel is also there. I think Dugel is there. It's a brand of metronidazole produced by Juhair. There are many of them. This company now can now import these drugs, the raw drug now, and manufacture the medicine in Nigeria, because the patent right of the first company has expired. Does it make sense? Yes. Now, that is what I mean by what? Innovator brand. There are many companies that have innovator brands. Before your company, as a pharmaceutical company, get to a level of discovering your own molecule, that means people have money. It's not easy. There are sometimes that you may even discover up to the end, it will rubbish. That money waste. Maybe the drug is not good for the human system. Maybe the effect is too much. It will not be approved. So the money you spend will just do room. So it's not easy to discover a molecule. It takes different stages before you get there. That's why for up to 20 years or so, no company will go near until, do you know what it means? That if that you are the only person that will be in charge of a drug worldwide, and if you market it well, money will finish you. Now you go dey run, money go dey pursue you if you market the drug. That's why they have to have their own brand name. We call it innovator brand, so that they can market it. So brand name, apart from chemical name of the structure of the drug when they discovered it, and the generic name with which they used to register it for approval with WHO, then they need a brand name they will use to market it, so that this name will be bid for them alone. Like flagyl, the drug, the generic name is paracetamol, so it's metronidazole, but they need a name that they will use to sell that molecule. They call it what? Flagyl. Now, because of it stayed in the market for 20 years without interruption, it's an enter the people's what? Some even come and tell you, give me flagyl. Okay, give me that flagyl. There's no flagyl on the packet. To give me that flagyl. That flagyl is okay. That company flagyl by this company. Give it to me, no problem. give me flagyl by Emzo. Give it to me. I'm not communicating. So, but unless but that's how Nigerian companies can market their own. That's how they can market their own brand. You may even swallow the name in the innovator brand. It's marketing, not easy. There's one anti-malaria in Nigeria that they marketed so well that if you're not careful, you will think is the innovator brand. Tell me that. Tell me that name. Tell me that name. Eh? There's one malaria anti-malaria that is in the lips of people. That brand name. Lomatampa. We need one. Quite try, but I mean Nigerian own. Amatem is putting weight now, but there's one. Lonats. Is that what? Lonats. The way they market that name, the way they market this. Everyone, give me Lona. Even though they should not even care about the price, just give me Lonats. Am I communicating? Yes. Most of these companies, I don't know if Lonat has started manufacturing in Nigeria. I'm not sure, but I know that they used to do contract manufacture. After I check, let me know whether they started manufacturing. But I know there was a time they were building their own manufacturing outlet in Lagos. But I don't know. I have not checked up again to know if they've started. But I know they were building something that as at how many years ago. But I have not checked to know. It's been long I left the field. I have been in classroom for up to 5 years now. So it was when I was in the field, I was doing rep marketing. That's when I was conversant with all those brands. Or since I entered into academics. Yeah. But the point I'm trying to make is that they would go. Most of these Nigerians they go outside, meet some Indian companies, and they have some companies outside, or even China. They just build company. They don't have their own products. All they do is that people come from different countries. They do what is called contract manufacturing. We call it contract. People come from different countries, come there, tell them what they want. Of course, before you call, you must have, if you're Nigeria, before you go there, you must have gone to NAFDAC. Tell them what you want to do. NAFDAC will link with the company you want to. The company will send them their documents to be sure that this is what they are doing. If NAFDAC approve, you can now go there. If it's paracetamol, if it is anti-malaria you want them to manufacture for you, they will manufacture it there in their company. Give you the name you want. Give it the brand name. Of course, you must have registered the brand name here in Nigeria. So you can have your trademark, so it can belong to you. You go there, if it is artemether lumefantrine, they may call it, if your name is Ada, you can decide to call it Adatem. Now, if you tell them that you go and register that Adatem here in Nigeria and go there, they will manufacture the same drug, artemether lumefantrine for you and call it Adatem, package it for you, the way they package it well for you. Then you come down to Nigeria, what you see in the packet is manufactured by so company in India, marketed in Nigeria by your company. Maybe your company may be Ada Pharmaceuticals. Marketed. Then when you now come down to Nigeria, you start marketing. If you market well, that other term may replace older brands. That if it's not other term, you're not serious. Another company in Nigeria may still go to the same company in India. They will manufacture that same alternative, but for them, with another brand name. They may come down here. You see a human being saying that other thing is better than this one. You wonder how. Marketing. You know the same company that produce for two of them. But the way I'm marketing my own here, people will buy my own more. So it's all about what? Marketing. I don't know if I'm competing. So I'm trying to point out what branding means. Branding is all about you. People don't joke with branding. That's why if you do nonsense and go and try to pull down somebody's brand, the person can do anything to you. The person can do it, can sue you, you can pay for damages, because if that brand is spoiled, nobody will want to get that name again. Some company whose brand name has been spoiled go to change another name because they know that something is following that name again. They wouldn't want it. So brand name belongs to a company. If you dare go and use that same name, if they catch you, you will pay. You will pay for your nose because you may formulate nonsense, and they will say that it's their own, and you spoil their name. Even if the owner is a very bad person, he want to maintain a good brand name. They don't play with it because that is their brand. I don't know if I'm so. Brand name is a very serious. Branding is very, very serious. So brand name is a name that the manufacturer words assigned to their own words. If it's paracetamol, their own paracetamol. If it is metronidazole, their own word metronidazole. Am I communicating?
Yes.
Good. And if you are a company that produces even if it's ordinary vitamin C, and you're able to market your vitamin C well with that name, but you spend money for you to be able to penetrate the market. You will spend a lot of money. Okay.
The same, for example, that's at the time that you have. You marketed the same
Okay.
And same other time you go outside Nigeria too.
It depends on the country. If you succeed in registering it in that country, like Ghana now, if you succeed in because if you go to that country, you register it with their own drug control this thing. If you are able to register it with them, you can market it there. You can market it there. Some Enzo brands are sold outside Nigeria now. Some Enzo brands are sold outside Nigeria. At least I'm sure of that one. The point is that if you're able to market it, have an office in that country. I'm not talking about smuggling, parallel importation. That one is smuggling. If they catch the person smuggling, it's a problem because the government need to know what is coming into their country. Yes, so that if there's any issue, they know who to trace. Yes, the country need to know. So some of these foreign drugs that they bring in, I'm not saying it's bad, but please, it's always good to go through for the 1.5 NAFDAC number. Because if anything happens, who are you going to even call? Do you even know what they packaged and sent? All you know is that it's a US drug. Who told you it's a US drug? It's not what they write there. True of us.
Because some other person can still go and package or manufacture something else and write it at that time, maybe to send it to your resume.
If that one is now an issue now, if the person, if the person is caught, it's an issue. People do it, but it's now left for if such thing exists, you can now track. That's why you should know to register with NAFDAC, so NAFDAC will know who is who. One NAFDAC sees such thing, they will know. Am I communicating? Yes. They will know that this one doesn't come from our company, from a company that has registered with us in Nigeria. I don't know if I'm communicating. Yes. So that's all about what brand name. So a particular drug may have uncountable, but you cannot count the number of brand name the drug may have. Because even as we talk now, even as we are here now, some companies are manufacturing their own to keep their own brand name. But even as we talk now, some people are going to register a trade name, a brand name. Am I communicating? So you can never know all the brands of a drug. It's not possible. You only know the ones you have seen. True of us. And that's why it's not for uniformity. The name that is recommended for prescription is what? Generic name, not brand name. That's the reason. Because I may be a doctor and prescribe paracetamol for somebody. Instead of me to write paracetamol, maybe my father or my brother opened a pharmaceutical company yesterday, and he has a brand called one name, Adamol. My auntie has a company and call it her paracetamol, Adamol, because of course everybody want to push his or her family's business. True of us. So because of that, now maybe I am working in Lagos. My sister, my aunt is here in Anambra State, and her Adamol. They have not even produced millions of cartons that we can get to Lagos. Maybe the ones that she has produced is still have not before she produced. People in Britain has come and much has not secreted in the country. No, I will stay in Lagos and be writing Adamol for people and say you must buy this. If you know this one, don't buy you. Then the patient will not carry it and go the whole Lagos looking for Adamol. Then if he goes to a company, they say this Adamol is paracetamol now. At least I think I've seen the advert somewhere, or I think I've seen it's paracetamol. He say no, my doctor say that if it is not Adamol, I will not buy. Wait, see, this thing is paracetamol. I'm sure. Okay, see him there. See it. It's in them there. See now, Adamol, paracetamol. See, my doctor said. Now, after jumping the whole Lagos, coming the whole Lagos, he may not see it. So you see how stressful it can be. So the best thing is to do what? Write paracetamol. If the patient goes to the pharmacy, any paracetamol they have, you give. Except in some cases whereby you are sure your pharmacy or pharmacy around has a particular brand and you have interest in that brand. Am I communicating? Yeah. You may be the interest because you have used it. That brand, you like that brand. Or maybe your father has a pharmaceutical company and your father's own is Adamo, and you are using it and it's working. In level of conscience, it's working, and you want to promote. If my father's brand is working, I'll promote it now. Yes. If information come, see Delia Adamo, see Jeba Gotia, I will do it. Yes, I will do it because I'm sure it's working. So why will I leave first? I was they go and get another brand. That one is working, and he can assess it. Listen carefully. It's effective. It's accessible, affordable, available. I'll read that one now. In that case, you cannot say you should not, but to be putting unnecessary stress in the hospital where you are working, maybe that hospital stocked a particular brand because your Adamol is not in that hospital. Because you are Adamol and that brand they have in the pharmacy is working, it's effective, and your Adamol is not there. Maybe one rep even came and gave you money, gave you everything you need, and you leave the brand, you leave what you have in the shelf, and be prescribing other more, so the person will go outside and start traveling to look for other more. Don't worry. After come and collect your are what? Your salary, you will go. You must work with the pharmacy to know what they have. Or better say, just write paracetamol. If you cannot write the brand they have them, write paracetamol. The pharmacy, the person will go to the pharmacy to look for it. If you get there, any brand they have there is good. For it to be brought into a pharmacy where a pharmacist is working, unless you're saying that a pharmacist doesn't know what he's doing. The same way you, the doctor, you also don't know what you're doing. At the same time, the medical lab scientist that don't even know what he's doing. If the pharmacist doesn't know what he's doing, am I competing? That is his own field. So when you have a pharmacist working, and you have a drug committee that look at drug before you know, it's not only pharmacists that make the drug. A good hospital is not only pharmacists that is there. The other group of the drug revolving fund, they consider the nature of the drug, the medicine they are bringing. Is it from a reputable company? Is it cost effective? Has this stood the test of time? Is it a new product we don't even know whether it's okay? Once they have look at all those things and approve that the drug should be procured in the pharmacy, you left it and be prescribing for somebody to go outside because that person is your friend or your father, and or maybe the person is giving you one or two things. That means you are not doing well. So to avoid all this nonsense, that's why they now say that recommend you use what. So if the person goes to the pharmacy, any brand they have, they will do what. There's a course you do in your first semester final year. We call it essential medicines. I think I also handle it. You understand that is you don't come to essential medicine and be talking about brand name. It's the only name. Don't worry, in your final year I think that should be your first semester final year. We'll discuss that. Okay, so that is all about what? Brand name. What's time? 1:24. When I enter here, class, you don't give me attendance again, no. All these lectures are coming. When I enter here. So we are done with classification of drugs. We are done with drug nomenclature, right? So next thing we look at is what? Sources of what? Have we done sources of drugs? Next we look at the sources of drugs. After that we look at routes of drug administration. Check it now. Is it root or route? It's root. No. Trade name is brand name. Yeah. Trade name is. Any question?
The first thing you said under prescription of something like those
What?
those boys under prescription.
Here.
No. It's the first one.
So what about it? These are just some terms that associate with drugs we are defining. These are some terms. Okay? These are some terms we are defining. You know that I told you when we talk about pharmacodynamic agent, I told you something about receptors, right? Yeah. Receptors are just some molecules in the body that provides what looks like lock and key, where the receptors are like the lock, then the drug is like the key, and the drug now fitting into the what lock, which is receptor. Receptor is just molecular sites in the body. Now, when these pharmacodynamic agents fit in, they cause a change in the what? In the what? The receptor that will not translate into pharmacodynamic change in the system. Okay? So that site is the receptor. And that thing that's locked into it can be drug, it can be other, but it's generally called ligands. They are generally called what? Ligands. Ligands. They bind, right? They bind to the molecular site called what? Receptor. So when they bind, they cause the change in the structure of the receptor, and a lot of the changes in the system will now take what? Just like somebody having the key, you have a padlock here. It's only someone that has the key. Once the person put the key and open it, the change that will occur is that the padlock will open. You can open the door, right? So that's how these things work on the receptor. These are pharmacodynamic agents. I'm not complicated. They can be drug, they can be other substances that can fit in. Am I communicating? So now, sometimes when this molecule interacts, there are some drugs. When you now go down to drugs now, the one that are drugs, when the one that are drugs are the one that interacts with the receptor to activate it. Those that activate are called what? Are called what? Agonists. Not I have defined receptors now. Those drugs, if the ligand now, the one that I told that ligand go to receptors to cause change. Under ligands, we have drugs, other substances. But under drugs now, what we are treating is drug. Under drugs now, we have the one that fit in to activate it, right? Yes. Those one we call it what? Agonists. Agonists. Are we together? Yes. Then we have the one that cause inhibition. Maybe they may block the receptor to avoid other ones to interact with the receptor. They will not do anything. Things like that. We call them what? Antagonists. There are different types of antagonism, but they are just known as generally antagonists. Okay, we have those ones that work pharmacodynamically. These are the ones that we are talking about. What? Receptor. Okay, we have the competitive. Specifically, we call them what? Competitive. They compete with other agonists with what? For the what? Receptor. Okay. Now that one we call them what? Antagonist. So now the receptor is that side, that site in the molecular and biological system where this whole thing happen. Of course, receptor play a regulatory role in the body. Am I communicating? So these are basically the things I want you to note about it. I have mentioned agonist now. I have mentioned ligand. I have mentioned receptor. I have mentioned antagonist. Maka mwaga list ya say kowa. Ichare baya. Yeah.
Like abortion pills, where are you to place them under? Abortion pills. Under therapeutic and dynamics.
Oga. Oga, why are you going to abortion pill here now? Why must you be that one you're asking? Hey! Yeah, for all the thousands of drugs you didn't see, why abortion? No, wait. I know you're asking why. Asking why? It's so hard to me. You didn't even talk about paracetamol, abortion, straight. All right, let's continue. Now, is abortion legalized in Nigeria? I can't say that question. Now, you know what medicine is, right?
Yes.
You know what medicine is, right? Good. Good. We have defined medicine here now. What are medicine? They are preparations, right? Containing what? Drugs and the what? Good. God bless you. So of course you know what excipients are, right? You can define excipient and explain them. They are those ones that are added when you are manufacturing what medicine, right? And they serve different purposes like what and what. They serve different purposes like what and what. Ndị agha agụ akwụkwọ. What are they serving? Okay, go to your material. Yeah. So what they serve? Okay, basically some are added to help the drug. Basically, any excipient you are adding when you are formulating a medicine is either to allow the drug to be properly delivered into the system. It may be that the drug will help the drug, the excipient may help the drug to be what? To improve compliance, make it palatable. Maybe if the drug is bitter, it will be added to help to improve the taste. That you start seeing things like flavor. Flavor is an excipient. Flavoring agent, the excipient. They're under flavoring agent now. Vehicles. You see things that even sweetness. Okay, these things. Then it may be that it is added so that you'll be able to formulate it in a particular dosage form. There are some things you added you call diluents, so you can be able to bulk the what small drug to have a sizable tablet you can punch and produce easily. So there are different. These things are here. You mean this is are here, right?
Yes.
They are here.
Yes.
What is it? You see how you have this. You say you show that you have not been reading this thing. What is here? Excipients are what? They are added to aid manufacture of what? Medicine. To improve its chemical and biological what? Stability. Some makes it to be what? Stable. I've talked about suspending agent. It's an excipient. In a suspension, if you don't put suspending agent, the suspension will the particles will go down and cake. We call it caking. You cannot break it. If you kick and remain there, it has spoiled. Hasn't this spoiled the medicine because you did not put suspended agent or because you did not put the good one? In tablet, there's also an excipient we call the disintegrants. Disintegrants. If you take tablets, it enters your stomach. It will help you to break down. Once the tablet absorb juice, gastric juice, moisture in there, it will help you to do what? Break down. If you don't put suspending agent in your tablet, it will become stool. If you take the tablet, it will go out from your nose like that. But remember, it's only when the tablet disintegrates that the active ingredient inside the drug will come out and be absorbed, right? So if you take the tablet and it doesn't break down, will the drug come out? So the tablet you put in your mouth will leave your anus like that. In your supporter, if you poop, it will come out from your poop. Will it work? No. If you have a headache, the headache will deal with you because the drug has not come out. True of us? There are some excipients you add to tablets. We call it binders to make it to be come together to be strong. If not, if they produce their tablets before it travel from the company to the market to a pharmacy or policy, it will turn to dust. Have you seen tablet like that? Yes. The binding agent is not as strong. It's not. The binding agent should be strong, but not strong enough that it cannot break down. If it's not strong, if it's not a good one, if you open the sachet, what you see inside the sachet is powder. The tablet will break into pieces. Do you understand what excipients are? Yes. There are some that you just want to add for aesthetic values. If you see tablet, the tablet will be shining. Oh yeah, take me. taking me to attracting you is shining because of what they how they do what finished it. They are also what excipients. Class will start from what sources of what. Please study ahead, please. Study what ahead. You must not wait for me. Tahi ajaja. Tani ajaja. Take. All right. Thank you very much for your attention. By God's grace, let's see how tomorrow will look like. By God's grace. Hey, I'm asking about a weekend. Hey, nah, hey, can't do it because you would dog on Mondays now, right? All right, Tuesday by God's grace. All right, thank you very much. See you next time.